Today we're joined by Dr. Laura Shaffer, a psychologist at UVA Children's Hospital. She's sitting down with Casey.
All right, thank you so much, Steve. Thank you so much for being here with us today.
Oh, you're welcome.
First of all, tell us about some of the most common mental health challenges that are faced by children.
Yeah, so some of the most common challenges revolve around anxiety and depression, mood concerns, lots of worry. The CDC just came out with some new data showing that 3 out of 5 teenage girls report feeling persistently sad or hopeless. So we've seen those were problems before the pandemic, and we've seen a marked increase with really doubling here in the U.S. and worldwide in those and eating disorders.
Yeah, it's hard. We've seen so many stories on that too. It just really does seem like it's a bigger issue now. Tell us a little bit about how parents and families can really foster and support their child's mental health.
Yeah, so I think a number of the things we think of in general with health, so promoting good, healthy sleep, adequate sleep. And a lot of people are really surprised by the amount of sleep that is. For younger children, it's 10 hours. Teenagers, it's 9.25. So adequate sleep, adequate exercise, healthy eating. And then a really big one is in-person social contacts. And so really maintaining those face-to-face contacts and using social media to enhance those relationships rather than replace them.
Yeah, that's a really good way to look at that. What would you say are some signs and symptoms of maybe a potential mental health issue that parents can look out for in their child?
Yeah. So I think it's really important for parents and caregivers to look for changes in behavior and changes in mood. So if a child becomes more withdrawn, they're spending more time on their own or away from friends, staying in their room more, getting in trouble more at school, being more defiant at home, just more irritable, those are not necessarily indicative of a mental health concern, but certainly red flags.
Right, something that should alert you. And tell us a little bit more about, I know there's a partnership between UVA Health and Sentara Martha Jefferson Hospital to really expand mental health care access to children. Tell us about that.
Yeah, so we are really excited about this. So this is a new UVA Children's Clinic, that neurodevelopmental and behavioral health clinic that is funded in part with generous support from Sentara Martha Jeff and some private donors as well. And we'll be providing assessment and treatment for child mental health and developmental disabilities. We'll have UVA child psychologists, developmental pediatricians, a child psychiatrist, and an integrative medicine specialist, so we can really provide holistic assessment and care for children and families.
That's wonderful. Yeah, like we said, something that's so needed right now, and it's going to help a lot of people. Anything else you want to add that you think people should know that are watching before we go?
Just to, I think I'm really encouraged and my heart's warmed by all the attention that people are giving to child mental health and well-being. It's been a crisis in our country since before the pandemic that's only been exacerbated, and I'm just grateful to everyone who's working hard to try to turn this around.
Yeah, well, thank you so much for being here, and thank you for the great work you do.
Oh, you're welcome. Thank you.
Yes, we will have you back soon, definitely. And Steve, back over to you.